So our last speaker of the day is Gina Fernandez, and she is an occupational therapist registered with the College of Occupational Therapists in British Columbia, and is also a member of the Canadian Association of Occupational Therapists. She graduated from UBC with a master's degree in occupational therapy in 2008 after finishing her bachelor's degree in psychology from SFU. Gina is also Power Move certified and has experience working in both the public and private sector in both rural and urban settings. After working in the public sector, Gina founded Enable Occupational Therapy in 2014. So please join me in welcoming Gina.
So I'm Gina, and thank you for the fabulous introduction. So I feel like they put me at the end of the day today to do one last injection of energy. So please bear with me. I promise I will make this fun, interesting, and very relevant. Okay? All right. I like to inject a lot of humor into my PowerPoint presentations because I feel otherwise people's eyes start to glaze over. Okay. All right. So, okay. Here we go. So you did a great introduction. You went through all my fabulous credentials. One or two things of note. So they mentioned that I was a PWR certified therapist. So I will be touching on a few points of that throughout my presentation and the benefits of exercise. So I do teach boxing. I am also a dance instructor. So there's multiple ways to get exercise. And I think there's fabulous benefits to both styles. Okay. So I thought I would explain about what occupational therapists are, okay? Most people go, oh, hey, are you like a physio? Well, similar, but not the same. So I'm going to go through a bit about that. So all of us practicing in British Columbia or Canada, we have a bachelor's degree or a master's degree in occupational therapy, which means we went to school for a really long time. So we are trained to understand not only the medical and physical limitations of a disability or injury, but also the psychosocial aspect. So this is really, really important. We work in the field of mental health. We are also thinking about the cognitive aspects 24/7, and you're gonna have to listen to me talk about it. Okay. So we look at the whole person. So we are a regulated medical professional by the College of OTs of British Columbia. So yes, you do get a fancy receipt with our college ID number if you come to see us, okay? So we are regulated throughout Canada. So once again, just like physios, just like doctors, same thing. So what is occupational therapy? So it is the art and science of enabling engagement in everyday living through occupation. We enable people to perform the occupations that foster health and well-being. And we want to enable a just and inclusive society so that all people may participate in whatever they want. So in general, we help people do the things that they find important in their lives. And it's different from person to person. So let's think about what your occupation is, because people always say to me, hey, Gina, I'm not working anymore. You're not relevant to me. Okay. Okay, but we all have occupations. Are you a mom? Are you a grandparent? Are you a husband? Wife? Are you someone's daughter? Maybe you like to do some part-time law work on the side, okay? Maybe you decided to go back to school because tuition is free after 65, right? Maybe you're a PSBC group facilitator, okay? All those awesome support groups that PSBC has around the Lower Mainland, there are some amazing people leading those groups, okay? Maybe you are a golfer, right? Maybe you like to do that on the weekends, okay? Or maybe you're just a comedian who happens to attend my boxing classes. I see you guys. Okay. So who can benefit from OT services? Basically, anyone having difficulty participating in activities due to an illness or disability and or the social, institutional, or physical environment. And I'll get into that in a bit and explain what those fancy words mean. Okay? So if you call in an OT, we will assess and evaluate your occupational performance. So this means your ability to choose, organize, and effectively and safely perform your everyday activities. And we look at the relationship between the person, the occupation, and the environment, because they all affect each other. So, how can occupational therapists help? Well, I told you it's not just for work, okay? So we look at self-care. Are you able to have a bath? Are you struggling with certain things? Getting in out of the bathtub, reaching your hair to wash your hair. Can you reach your feet to wash your feet? Dressing. How about those lovely small buttons and zippers that we all like to try and struggle with? Okay. What about those really tight-fitting jeans you're always trying to pull on? Okay. What about grooming? So what do we mean by that? Can you hold a comb? Can you grip it? Can you bring it through your hair? Do you have, as we say, the range of motion to reach the top of your head and bring your hand back down? What about toileting, right? Are you able to get on and off the toilet? Do you have the grip strength and the dexterity to actually unbutton your jeans, pull them down, wipe, pull back up, right? Feeding. Can you hold a spoon or a fork? Can it actually reach the food? Are you able to bring it to your mouth without it shaking and spilling? Do you have the coordination to use two hands and cut your food? So have one hand with your fork, one hand with your knife. Do you have the dexterity to use chopsticks? These are all things we look at, okay? Home management, okay? Are you able to do your cooking? So can you reach your pots? Can you put water in it? Can you cut up your vegetables? Can you open packages? Can you open jars, right? Let me tell you, OTs have some fancy tricks for that and some fancy equipment, which even I have in my kitchen for those pesky jars, okay? Cleaning, can you use a vacuum cleaner? Can you reach those hard to reach places? Banking, can you do your online banking? Can you problem solve? How to do that? Can you go to the bank teller, if you just still like the person-to-person interaction, and pull items out of your wallet, separate your bills with your fingers, okay? Grocery shopping, okay? Can you carry those huge bags? Can you work the online or fancy self-checkout if you want to do it that way, right? Can you drive? This is a big one, right? So can you grip the steering wheel? Do you have enough range of motion in your head to turn both ways, okay? Can you remember what you saw when you did a shoulder check? Right? These are all things we have to keep in our head. Productivity. So if you're a student, okay, are you able to go to class? Can you focus? Can you hold a pencil? Can you write? What about work, right? Some people are still working. Are you able to handle the craziness of being an executive assistant and handling all those phone calls, or customer service, you know, having all those customers line up where you work your cash register, okay? And volunteering. So are you able to do that to the level you want, right? Being able to stand there for those marathons that you're volunteering for, holding out cups of water to all the runners. And leisure, one of the most important things. Leisure brings joy to our life, right? So our hobbies, anything we like to do for fun. So how can OTs help? The first thing we look at is, can we remediate a deficit? So everyone says, well, I don't even know what that means. So can I teach you a skill to address the challenges that you have and restore function to your hands or your legs or your brain, okay? Or should I show you a very cool, fancy strategy that is actually easy to implement, okay, to adapt a task or routine? Or can I give your family members some tips on helping you out? what are some things I might do if I'm doing that approach? Well, I might give some adaptive equipment, which I'll get to in a bit. Maybe I'll look at the environment, I'll look at the family support, and think of different ways that we can accomplish that task. It may not be the same way as you did it before, but will still help you figure out how to do it, okay? So sometimes if people have a brain injury or stroke, or they're having challenges with memory, I'll give them a notebook, I'll give them a really cool memory board. For those people that love smartphones, I will show you some fancy features on it, okay? Sometimes what I'll do is I'll give someone a mobility device, otherwise known as a gait aid, okay? Because you're having difficulty getting around. And that's something physiotherapists and occupational therapists can both do. And I might just go into your home and make some suggestions on how to modify it, right? Just to make it easier on your legs and going from sit to stand, okay? So there are lots of things we can do. I can give people exercises, I can give them stretches, I can maybe give them a fancy splint so that their hand is held in a nice, comfortable position because maybe their arthritis is bugging their fingers and their hand at night, okay? So what are the things that I have to think about? Well, think about the person's physical abilities. Think of the social environment. Think of institutional. Think of cultural, right? Am I providing these recommendations in Canada or am I somewhere overseas? Because my recommendations have to be culturally sensitive and appropriate. And I have to look at the person and just really think about their physical abilities, how they are feeling, and where are their cognitive abilities. And I'm going to go into this a little deeper in a sec. But the one thing we also consider is something called spirituality. So what do you consider to be your guiding life force? What do you believe in? Because once again, I want my recommendations to be in line with what you believe in. So what are environmental components? Well, I have to look and see, well, what are the barriers to you participating in whatever you want to do, okay? So I take a look and I'm like, okay, well, you know, you're using a wheelchair, so you probably can't go up 7 flights of stairs in your wheelchair. Let me go in and recommend a ramp, okay? Or maybe you're struggling just a little bit on stairs and maybe you just need a railing for your stairs, okay? I will look at the noise around the environment, so maybe you need to work in a quieter area at your workplace because now it's a little harder to filter out all those distractions. I'll look at the geography, so are you living in a small town up north? And that maybe, you know, you have to travel really far to get to the community center for your exercises. What sort of housing do you live in? Once again, is there tons and tons of stairs? Is the elevator always broken? I need to look at those. Then I look at your social support system. Who is your support network? Is it your family? Is it your friends? Is it the support groups by Parkinson Society BC? I need to look at all of that. I need to look at the social norm and expectations because I need to think about what you want and what would be the social norm for you. Then I need to look at institutional things. So I need to look and see, okay, financially, are there any barriers that you're experiencing? Are there any legal barriers? Or do I have to come in and say, hey, according to regulations, you need to fix this building so my client can get in and access services, okay? Do I have to think of the policies that we're working around here, right? Because maybe the employer says, hey, can't accommodate that request in the work environment. Okay, do I have to look at your resources, right? Once again, thinking of your community. And then cultural. So I've done a lot of work overseas. So once again, thinking about roles, right? Is someone a wife? Are they a husband, right? Values, does someone value the ability to cook or do they really not care because they never had to cook their whole lives, okay? I have to look at expectations, you know? Is this person culturally expected to be able to cook? So even though I say, hey, not the best idea for your legs or your hands, but it's something you find important, I have to keep that in mind, right? And once again, customs. Right? So once again, just thinking, hey, you know, if I'm in Asia, is this raised toilet seat really the best thing? Probably not, because, you know, bathroom doesn't look the same. Okay? So let's talk about person components. So I will always think about these things when I'm working with someone. So I look at their strength, okay? What can you lift? Can you lift your body weight? And in what settings? So off a bed, off a chair, while you're walking. I look at your endurance. Are you tired after the first 5 minutes of meeting me because I just kept talking? Or are you just tired after I make you do one sit to stand? Okay? I look at your range of motion. So I make you reach your hands in the air, off to the side for various things, right? Because that's important. Because what if you're at home and you drop a pen and I didn't look at your range of motion, you reach for that pen and you reached a little too far. Okay? I have to think of your mobility. So are you currently walking? Are you using a wheelchair? Are you using poles? How are you getting around? Okay? I have to look at what we say affective or emotional. So how are you feeling? So yes, I can give you all these ideas and recommendations, but I have to think about how you're feeling, okay? Because if you have feelings of anxiety or you're depressed, I can't just walk away after I give you my list of recommendations. I need to figure out a way to support you so that you can move forward with how you're feeling, right? And that's the same thing of expression of self. How do you express yourself? I need to keep that in mind. So then I look at your cognition. So attention, right? So once again, I look around. There's like, are people actually paying attention to what I'm saying, right? Are you able to remember what I said? So if I'm giving instructions and I say, do 5 sit to stands, do 2 punches at the top, 2 punches at the bottom during my boxing classes, I have to look at your problem solving. So if I give you a new scenario, can you figure your way through the scenario or through the problem, right? So the example I like to give is, your old trusty laundry machine breaks. You have to get the fancy new one, right? Are you able to figure out how to work it, right? And yeah, they give you this super thick instruction book. Who really reads it anyways, right? So maybe I need to go through and break it down for you. Then I have to look at multitasking, right? Biggest example I give is driving, right? Think how much stuff you're doing. You're paying attention to the cars on the road, paying attention to the cars over here, looking over there to make sure there's no cop to give you a speeding ticket, right? You got to keep a lot of things in your brain when you're driving, okay? Then you have to look at organization, right? Can you organize your life knowing that you have to cook dinner for this person, grocery shopping on this day, pay the bills on this day? That's a lot of organizing that we have to do in this day and age. So you're all like, well, so we came here to talk about falls. Why is she still talking about this? I'm going to tell you in a second. So let's walk through what goes through an OT's brain when we're brought in to do a falls assessment. So this is not everything that goes through our brain. It's just a snapshot. Okay, so falls assessment. So first thing I ask people, what were you doing when you fell? 90% of the time, people say to me, I was running to the bathroom. Okay? I don't hear a lot of people saying, yeah, no, I just was leisurely going to the kitchen. It's usually I was running to the bathroom, okay? And I say, well, why were you running to the bathroom? Like, why couldn't you go slowly to the bathroom in your room? Why were you running all the way down the hallway to the main bathroom? And then they say, oh, but that's because there's no grab bars set up in my ensuite. I only have it in the main bathroom, right? So once again, walking through different things, how can we set things up differently? Okay? Time of day, right? Some people, they wake up in the middle of the night to go to the bathroom, right? Yeah, we're not always super awake in the middle of the night, if you haven't been sleeping well, right? So once again, thinking, when did you fall? Was it in the middle of the night? Was it in broad daylight in the middle of the day? What had you done before you fell? Oh, you were cleaning your garage for 2 hours before you fell. Okay, let's think about this, right? And the last question I ask is I say, were you delirious due to a medical condition, having delirium, right, through maybe some medications, not being tailored to where you need to be, Or how many drinks did you have prior to your fall? Okay, I need to ask you this question during my falls assessment, okay? Because often people say, I was at a Christmas party, I had one too many, I knew I should have used, this or that, and sorry, okay? So the last one I want to talk about is footwear, okay? So everyone look at your feet. Just literally right now look at your feet, okay? So take a look at those shoes. Are they fancy shoes? Are they practical shoes? Will those shoes hold up to snow, ice, and puddles? I think I'm the only one that has those, right? So once again, thinking ahead. It is going to be winter here soon. There may be snow. So once again, keep in mind your footwear. Yes, I understand your outfit will not look as cute as those really nice red heels. However, it may prevent a fall, okay? Keep that in mind. And once again, always think, you can just bring those shoes in a bag to the event. No one's gonna notice you changing in the restaurant. Don't worry about it. Okay, physical endurance and strength. So we need to think about the minimum levels needed for walking or ambulation. So we need energy to walk, okay? So that is a known fact, okay? And if we're really, really tired, we're gonna be dragging our heels and our feet, and we're not gonna be walking with full, proper steps. So once again, thinking about what your day looks like, and that brings me to point number 2, structure of your day and the activities. So if you know that cleaning your garage for 2 hours is going to suck your energy, it's probably not a good idea to put it on the same day as cleaning your rest of your house for 2 hours. Let's think about pacing and spreading things out, okay? Conserve your energy for what you need to do and what you find important. Core strength. And I know everyone's like, why are you talking about that? We're talking about walking. Well, core strength is really important. Did you know that you use a large chunk of your core strength to go up and down stairs? Anyone here know that? Anyone? No? Okay. Tell you something new today. Because let me tell you, it's not just your lower extremity muscles, otherwise known as your leg muscles, that help prevent you from pitching forwards when you step off something. I need to keep the rest of my body upright. How do I do that? I involve my core muscles. So I'm not going to say you need to have a 6-pack, okay? But it helps. No, just kidding. We just want to make sure that you are using your core muscles and that you are not neglecting them, okay? So important thing to keep in mind. That's why if you join those fancy boxing classes, that's why I make people do things like planks and carry fancy stuff when they go up and down steps. All right, so I talked a bit about range of motion and posture. So let's talk about this. So lower body range of motion. Why do I ask you when I come to your home or wherever you are to kick your leg out, okay? I need to look at where your heel is, okay? If you have challenges extending your leg all the way, it's gonna be really hard for you to do what we call a heel strike, which is walking and putting your heel on the ground, okay? So yes, that's why I have to feel your foot and do things with it when I do my assessment, okay? So some people say to me, well, you know what, Gina, I don't walk, I'm in a wheelchair, so that doesn't apply to me. Sorry, it does, okay? I'm gonna tell you why. So if you're in a wheelchair and you're using your legs to propel you, once again, can enough of your foot reach the ground to dig in and pull your wheelchair forward, right? Because if it doesn't, what you're gonna do is start sliding out of your wheelchair like this, and you're gonna end up on the ground, okay? So this is very related to falls prevention, okay? I have to look at your stride length when you are walking, okay? So when you hear us screaming in our exercises, big steps, I need to see, what does your stride length look like? Or are you taking very small steps? And then I need to think about it. Is it because of the Parkinson's? Is it because of your range of motion? Do you have like a hamstring injury that you forgot to tell me about? right? I need to think about all these things. I have to look at posture and your perception of it, okay? So the first thing I always tell people in my classes is I say to them, I said, why are you looking at the ground? And everyone's like, well, I don't understand what you mean. And I said, no, literally. Every time you come in, you're like doing this. And people are like, oh, no, I just need to make sure I'm not falling. So fancy thing about gravity, wherever you're looking is where you're going to end up, okay? So if I'm looking like this, I am being pulled towards the ground. And if my upper body is being pulled all the way down, I will likely fall down there, okay? So this is something I tell everyone, even when I still teach dance classes, right? I say you need to put your head up, okay? You need to put your head up for a few other reasons, right? You want to make sure you don't hit the person next to you or walk into a wall, right? So be aware of your posture. If you have challenges with your posture, ask your partner or your friend to give you a few nudges, a few reminders, okay? And these are some things we work in our exercise classes, is we work on posture. So just keep that in mind. All right. Oh, it's going to pop up here. So the last thing I'm going to say is, so we know with Parkinson's that our posture starts to get a little bit like this, right? So this is why it's on the range of motion slide, is when you are like this for a very long time, these muscles get very tight, okay? So sometimes you have to go see a massage therapist, and they can work on these muscles and improve your posture, okay? So sometimes it's not enough to have your partner give you the nudge to say, hey, put your head up, shoulders back. Sometimes you do need to go see a massage therapist to get the range of motion back in your shoulders and your chest. And for those of you that spent a number of years working at computers or still do so or drive, it's still a good idea for you to see massage therapists too, okay? All right, so gait aids for mobility. So everyone says, well, what's a gait aid? My physio always asks me, okay? We mean walkers, canes, poles, wheelchairs. There are tons of types of walkers. They have 4 wheels, they have 2 wheels, they have no wheels, okay? Tons of canes. Some have 4 points on it, some have 1. There's those fancy walking poles, which are great, okay? And there's wheelchairs. Sometimes you just gotta use the wheelchair, right? But at least it helps you get around, because your options sometimes are use the wheelchair or don't get around, okay? So what I look at is, do they fit you properly? So I walk in and I say, oh, hey, that's so great, you got a walker. And someone goes, yeah, I've had it for about 10 years, and it's great. And I'm like, okay, so people's spines change. Sometimes we get shorter, or our posture changes, and sometimes it needs to be reassessed because your body changes over 10 years. I know mine has, okay? So I also have to look at a few other things. Are you using the right one? So if someone says, hey, my physiotherapist told me 10 years ago to use this walker. Okay, so I get that, but 10 years later, your function's a little different, right? Not for everyone, but the majority of us. A few other things. Have you practiced with it? So I know this sounds like a joke, but it's not, okay? So I always tell people, that's so great that you got the walker. And they're like, yeah, it's been sitting in the box for 4 weeks, it's really pretty. And I'm like, okay, so like you need to practice with the walker, not just get the walker. Right? So it's not enough, excuse me, to have just the walker. You need to practice with it. So take it out. So I'm going to give you an example. You get a new car. Most of us don't want to drive it into downtown Vancouver the first time you get a new car, right? You're just like, let me try in my neighborhood first, okay? This is a really fancy new car. I don't know the turning radius. I don't know how to park it. There's too many fancy buttons on it. Same thing with walkers these days, people, okay? Every walker is different. Every walker turns differently. Every walker's brakes are different. You must practice with it. Start in your home, go to your neighborhood, then go out and about to the mall with it. But you must practice with it if you want to feel confident with it. Exactly like you would do with a car. You would try in the neighborhood first, and then you go into downtown Vancouver, okay? And that leads me to the next question. Where have you practiced with it? right? So if you tell me, hey, Gina, I fell in the mall and I swear I was using my walker, and I was like, oh, okay, like, how many times had you been to that mall? And they're like, oh, no, it's like the first time. I've never been to the mall ever. Like, not even before I got the walker. And I was like, okay, so here's the hint. First time you're using a mobility aid in a new place, maybe bring someone with you to help you navigate it, right? Because if you're trying to go through the parkade, hit the fancy button, that's maybe some weird touch sensor button, right? Get yourself in the elevator before that door closes, and then you're let out into this brand new mall with crazy fluorescent lights. I think a lot of us would be disoriented, right? Nice to have a friend with you, okay? This also applies to outdoors, right? So you need to think about the outdoors. Are they cobblestone streets, like Gastown, right? Or is it your nice flat neighborhood? Or is it a very narrow walkway, right? Or were you trying to get on a fast-moving escalator? Where have you practiced with your mobility aid? You must practice with it. And to feel confident in different environments, you must bring it with you there, okay? And I always suggest go at off-peak times. No one wants to be practicing during rush hour, just like you don't want to be driving during rush hour, right? So probably wouldn't pick a Saturday during December for Christmas shopping to go practice with your mobility aid in the mall. All right, cognitive attention. I asked people, what were you doing at the time? So you guys think this is funny, but do you know how people I've seen texting and walking into poles? Okay? I know some of you have done it. But it's true. What were you doing at the time? So a lot of people say to me, well, I was yelling at my kids and that's when I tripped and I fell, right? Or I was trying to figure out my fancy new smartphone and all these buttons, and then it went off, and then my Spotify gangster playlist went off and I couldn't stop it, right? Slow down, do one thing at a time, give all your focus to your task at hand, whether it's walking, doing stairs, or turning a corner. Really important. Put your smartphone away. Okay, memory. So this plays a really big part. So where were you when this fall happened? Well, I was somewhere unfamiliar. So I still work in the hospital. There are a lot of falls that happen at the hospital with our patients there. And sometimes all it is the person didn't slip on the water. They were just disoriented at night because they were half asleep and they wanted to go to the bathroom. They forgot that they were in the hospital, right? They thought they were at home, and they know when I'm at home, I get out of bed on the right side, it is 2 feet to the bathroom. So if you have any people coming to stay with you for Christmas, maybe walk them through a few times how to get from their bed to the bathroom, okay, during the day, so that it will help to stay in their mind, okay? Another thing, change of bedroom furniture, right? So all of us that have aging parents, we're always saying, oh, get rid of your old furniture. I can't stand looking at it. It's bulky, all these things. So then we go and we revamp everyone's furniture, and then it looks like a completely unfamiliar bedroom. So in the middle of the night, when our family member goes to get up and get to the bathroom, they trip and fall on a corner of the dresser. Right? So once again, putting thought into things. If the original bedroom furniture was placed in a safe manner that did not block their path, maybe try to put the new bedroom furniture in the same spot, okay? It might not look like you want it, but you're not the one going to the bathroom at night. Okay, cognitive problem solving. So a bunch of, falls happen when people are challenged to try and solve, a few problems. So I'll give you a few examples. So let's say we're going through a construction site. That's why I picked this picture. Vancouver's always going through construction, right? And they're like, oh yeah, sorry, this entire road and half the sidewalk is closed off. Just go that way, all right? If you're having challenges of problem solving, it's not that easy, right? You need to think about it. Okay, I need to go up this step. There's a wire pole sticking out over here. I need to get myself around it. So if you're having challenges with problem solving, take a second, ask your walking buddy beside you for a hint if you need it, and then proceed through there, okay? It's really important. So physical, how is your vision? Okay, so we need to go for regular checkups for our vision. Just being honest, okay? So our vision changes drastically throughout our lifespan. There's various things that can accelerate your changing vision, such as a stroke or a brain injury, but it's just really, really important to be on it. Okay, a lot of people say, hey, I didn't see it, hey, I didn't see it, that's why I tripped on it, okay? So once again, just going regular to make sure everything's okay with your vision. Do you need glasses? If so, please wear them, right? If you lose your glasses, put them on the fancy string around your neck. You don't want to do that, put them in your back pocket. Just make sure your glasses are on you, and please make an attempt to wear them, okay? Then there's the other lovely things that happen as we age called macular degeneration. Some people get cataracts. So that leads me to my last point, which is lighting and contrast. So you guys say to me, well, yeah, Gina, I can't prevent that. Thanks for pointing that out. Okay, so I get that, and that's why we talked about compensatory strategies. So your occupational therapist will come in and will say, okay, so we understand you have some challenges with your vision. Here's some ideas on how to make things really bright, really easy to see, and easy to navigate around, okay? We partner a lot with the Canadian National Institute for the Blind. You do not need to be completely blind to take advantage of their services. They have amazing, cool, low technology things that fit in your pocket, and high technology things you can use too to make your life easier. So once again, they're a fabulous organization. Please check them out if you have any challenges with your vision. So home setup. So we look at different things when we go to your home and we do a falls assessment. We look to see, have your stairs been maintained? Are there pieces missing? Are there pieces sticking out? Are they crumbly? Okay. We look at the height of your stairs. So let's look at, how tall we all are in this room. Turn to your neighbor, please. Tell me, are they the exact same height as you? I see some taller people here, okay? So this is something we need to keep in mind, okay? They try to universally design stairs, but let's be honest. Sometimes you're walking and the stairs are really little, so that's okay. But if they're really high, you have to lift your leg really high. Maybe you don't have great balance to lift your leg high. Maybe you don't have the range of motion to lift your leg high. You need to think about all this, but that's why your OT is there to help you think about it too, okay? We look at all the lamp cords and the phone cords that you have in your place, right? So yeah, those little decorative lamps, they are super pretty, but those cords, everyone trips on them, okay? So sometimes we might say, hey, we need to tape these cords down, right? We don't want people tripping on them. Throw rugs. Once again, very pretty items, but a lot of people catch their toes on them, right? So sometimes I say to people, I don't think it's the safest thing, because if you're tripping on it every single time you go to the bathroom at night, maybe you can put it somewhere else where it just looks pretty and it doesn't get in your way, right? Water in the bathroom, okay? Some of us live with other people that are very messy in the bathroom, okay? If you live with someone that's a messy person when they shower and there's water everywhere, right? Make sure before you get in that bathroom that the water's cleaned up, okay? At night and at certain times during the day, you cannot see water on the bathroom. So the person before you, if they are very messy, you make sure they clean it up after, okay? There's other cool fancy things we can give people, like very absorbent rugs and things like that. But once again, it depends on everyone's situation and the OT assessment. One of the last things we tell people is clothing and papers on the ground. Please eliminate clutter, okay? So your grown adult children are not trying to be annoying. There is a reason they are saying this, okay? They are saying this because they don't want you tripping and falling, okay? So what I tell people is, I'm not telling you to get rid of it. I'm just telling you to put it somewhere else. Put it in a box out of your walking path. I know it's really important to you. I'm not telling you to throw it out. Just telling you to move it, okay? Because once again, you want a clear path anywhere that you are walking. So what are some adaptations that we might give to help decrease falls? We might give someone some grab bars, okay, because maybe they need to hold on to something stepping in and out of the bathtub. I personally like to use grab bars every time I'm at a new, unfamiliar hotel. Handrails, as we talked about on the stairs. Furniture risers, if you can't go from sit to stand, maybe I will give you some equipment to elevate the height of your chair. Bath chairs, once again, if you can't step over the bathtub, get yourself on a bath chair. You just need to slide over this one. And get a commode at night. This is the #1 thing everyone hates me telling them. But if you are really that disoriented individual at night because you're just such a deep sleeper, get a commode at night beside your bed so you're not running to the bathroom while you're disoriented. Okay, so affective and emotional functioning. I have to talk on this because I said OTs work in mental health. Okay, so did you know if you participate in an anxiety reduction program, your falls may be prevented? Okay, when we are very stressed out and feeling anxious, we are more likely to fall. So there's practical, really specific strategies such as deep breathing, progressive muscle relaxation, meditation, sensory strategies, all kinds of things we can do to keep ourselves calm. There's also something called cognitive behavioral therapy, which is challenging different thoughts if you have a higher level of anxiety, and occupational therapists and counselors are trained to do this. And there's exposure therapy, right? So if people have certain fears about things, whether it's dogs or anything else like that, we're able to work with people on that. What is the goal of this? It is independence with anxiety reduction strategies to decrease your overall level of anxiety and enable someone to feel confident and remain calm when walking. So I have seen firsthand about people's feelings of anxiety and how when they are calm and relaxed, how they can execute something differently. So I'll give you an example. For those of you that attend my boxing and exercise classes, sometimes I will ask you guys to do different things, such as skipping to a really fun song, right? I have a number of people that will say, no, Gina, I cannot do that, I will fall. And I say, okay. So then I put on some music, and then I teach you a really fancy Indian dance move that goes like this, and then you do it. Happy, easy, with no falls, right? Depends on the context. So be aware whether or not you have feelings of anxiety. So what do you do after a fall? We're all gonna fall. Let's be honest. I've fallen twice this year. I don't know what I was doing. Probably running somewhere. We're all gonna fall at least one time. You have to know how to get up. You must go to these exercise classes. You must work with your occupational therapist or your physical therapist and know how to get off that ground. You must practice getting off the ground. It is important, okay? You have to remain calm. Get Lifeline, if people are telling you to get Lifeline, so that people know when you hit the ground and you can get help. And now there's new technology. Get a fancy Apple Watch. Get a Nest Cam. All these things can help you sense falls. So what are some cool OT recommendations we might give you in general that has nothing to do with falls? Organization techniques. How to pace your week. You might do a workplace assessment. Maybe some memory aids. Walk you through sleep hygiene, how to prepare yourself for good night's sleep. Maybe give you some adapted equipment for eating, doing buttons, zippers. Or maybe I'll give you some exercises to help you with handwriting and printing. So you're all gonna say to me, okay, great, now how do I find an OT? Well, there's the website, okay? www.caot.ca. Ask your family doctor, they'll steer you in the right direction. Physios know how to find us. And there are some free ones at your community health center.
All right, there we go. Thank you, Gina. That was wonderful.
Thanks.